everybody, Dr. Mankal here from Barrhaven Family Chiropractic. Today's video is going to be on demonstrating the Webster technique. For the past 23 years we've been helping women have healthier pregnancies. One of the ways that we can do that for a mother and child is to really look at the nerve function of the pelvis and the spine, and we want to be able to show you that. We have a real life pregnant woman here today that will show you how the adjustment is done so that people who are watching see that's very safe and very effective for mothers to get adjustments. So what happens in just the basic anatomy, that the lower part of the spine, the sacrum, it can rotate or shift, and if it does, it alters the shape of the pelvic bowl. So delivering babies vaginally can be much more difficult, leading to more medical intervention. So one of the ways we assess that is to do the Webster's technique, which I'll show you now on a real live pregnant woman. Nikita, present yourself. Wonderful. All right. So that's not a that's a real baby in there, right?
That is a real baby.
Okay. All right. So one of the first things we do, we have a nice comfortable pregnancy pillow. Pretty comfortable, Nikita?
It is.
Yeah, it's one of the rare times women can actually lie on their stomach when they're this far along. So one of the first things we do is, once to assess that back part of the pelvis, the sacrum, if it shifts, it actually alters muscle tone. So we're going to assess that first of all, and this is the way that we do that. And so we actually bring the heels into the buttock, and I can see that the left one actually goes closer than the right. So what that tells me is that the sacrum is rotated. So we're going to make an adjustment here on the with our table, and then I'll reassess it again. We want to see that leg length come even closer. So just get the right tension. Good. Got that again, Nick? Okay, so we'll check that again. So I'm way closer. Okay, I'm not sure if you can see that, but much closer. Then the other part of that is we're going to have her turn over. We're going to assess that round ligament, which is in the front of the pelvis. So we'll take this out. Okay. All right. So that ligament, kind of, one of the ways we find it is sort of a bisection between the belly button and the top of the pelvis here. And there's this ligament. It's one of the ligaments of the pelvis in the front here that actually has muscle fiber, so it can feel taut or tender. And so we're going to find along that midpoint and hold some gentle pressure. Sometimes they use this adjustment. Again, it's done for all pregnant women, and it's designed to maximize the pelvic function and to give the baby the best opportunity to present head down. It's not a treatment for breech presentations, but definitely can be very helpful. Good. Sometimes in doing this too, we can actually feel, again, if there is a breech, sometimes there's a shift and the baby gives it more room and we can go head down. We'll also assess the sides through the psoas muscle, so we'll do that with Nick. And those are pretty even. That's very good. And so that's kind of the way that it's done. We assess the back part of the pelvis and the front through that ligament there. Again, really to maximize the space within the pelvis to really ensure mom and baby have the best chance to deliver a healthy delivery. Okay? Hope that helps you understand. It's very safe and effective. And for pregnant women too, just to share some information with you, did a study in a hospital show that women who got chiropractic care reduce their levels of pain by like 50%. So not eliminates all, which it doesn't, but it definitely can be very comforting for you during delivery. Hope that helps you out, and we'll see you soon. Bye for now.